Dear Mr. Chairman and members of the committee, thank you for the opportunity for me to speak in opposition to Bill 7715. My name is Jane Yolen, and I'm the executive director of an organization called Protect Families First, which advocates for drug policies and practices that improve community health and safety, keep families intact, and reduce drug overdose deaths. I'm going to tell you a story that's all too familiar here in Rhode Island. On February 11th, 2014, one of my best friends, Ellis, died of a drug overdose. After she took the mixture of heroin and cocaine that her friend Shawn had sent her in the mail while she was in rehab, the person I knew, my fierce, artistic, loving friend, was dead. She had been in and out of treatment for years, but I never thought she would die from this. And in retrospect, she probably died because her tolerance was really low because she had been not using drugs for a few months. I was angry and I was sad and I didn't know what to do. However, when law enforcement officers tried to charge Shawn, her friend who had sold and sent her the drugs, with Ellis's murder, her family saw that this was truly unjust. Shawn was a friend of Ellis's and a person who was also struggling really hard with substance abuse. When Ellis sent Shawn a money order for him to purchase and send her drugs, Shawn, a person who was addicted, knew what that feeling was like, knew the agony of withdrawal, sent it to her. He thought he was doing her a favor. Ellis's family saw that Shawn was struggling with the exact same things that their daughter was and came to Shawn's defense, not prosecution, in the legal process, building a relationship with him and his family. Ellis's father told me, quote, "Parents who lose children to opioids have more in common with parents of children who sell opioids to those who die than not. And in that common experience, we find healing in coming together rather than blaming and othering when what we're talking about is behavior symptomatic of unwellness, not criminality." I'm inspired by Ellis's family during their grief to understand where Shawn was coming from and understand that charging him and others who sell people drugs will not solve this problem. Ellis's family brings up a really important point and a reason why I'm testifying against this bill today. Very often, people sell small amounts of drugs to support their own substance use habit. Denise, another mother who lost a child, told me, quote, "One day my son would sell drugs to his friend and the next day his friend would sell drugs to him. The seller and the user are interchangeable on different days." This brings me to my question. Who are we holding accountable in this bill? These aren't people we're talking about who are producing fentanyl in the factories that the Attorney General talked about earlier today. We're talking about people selling $20 or $40 worth of drugs at a time who have no control over what's in their drugs because it's already laced with fentanyl, because everything in Rhode Island is probably already laced with fentanyl. We're talking about people who may benefit from different substance abuse treatment and social services, not a life sentence in prison. My second point is that there is no evidence from states that have these laws that they deter drug use or drug selling. While there are many states that have the laws on the books, what are the outcomes that these laws have had? There's no evidence that they work. For example, in Hamilton County, Ohio, they prosecuted 53 drug-related homicide cases in 2015. And then in 2016, they had an additional 100 drug overdose deaths than the year before. We've tried decades of punitive policies for drug users and sellers that have put so many people in prison and ripped so many families apart. And now we have more drug overdose deaths than ever. The definition of addiction is continued use despite negative consequences. And by definition, adding more of these negative consequences doesn't affect drug use. Third, I just want to say that a life sentence is incredibly harsh and will have negative consequences on the children and family members of the person who is in prison, and that there's a ton of social and fiscal costs associated with having a family member in prison. In addition, it costs about $40,000 at least to incarcerate someone per year in Rhode Island, up to $160,000 per year. So we're talking about a cost of over $1 million, several millions of dollars per person who's incarcerated for a life sentence. When there are huge gaps in prevention and treatment resources, when people have to wait months to get on a waiting list to access treatment, I'm wondering if this is really the best investment of our resources. My last point, and something that other people, including Steve Brown, brought up, is that this law could have a really big negative consequence. The person who is with someone who is overdosing is likely someone who gave or sold them drugs. It makes sense chronologically. This law would make people very hesitant to call 911 in the event of an overdose for fear of their own punishment. We know we can keep people alive with emergency interventions like naloxone. We can give people a second, a third, a 10th chance at life with naloxone. To keep people alive, we should not be producing any disincentives for people to call the police in the event of an overdose, which this law clearly would do. While I really understand that people want to blame someone for this issue, people want someone to blame, and I get it, and people want to create legislation to address this problem. And I myself have also felt the despair, the grief, and the confusion that comes from losing someone. However, I hope you would see that this law would make a really big problem we have even worse, and I'm hopeful that we can work towards better solutions together. Thank you.
Thank you, Anna Jane. Imagine that Shawn had not sold Ellis a lethal dose of drugs. Imagine that Shawn and Ellis had gone out drinking for the night. And we're having a grand old time, and Shawn was driving.
Yeah.
And on their way home, they hit a tree, and Ellis died. Should Shawn be charged with a crime?
I don't think Shawn should be charged with murder. And I also think that that doesn't look at this issue as a mental health and health issue that addiction is.
Okay. Any further questions for Anna Jane? Representative Knight.
Thank you for your testimony and for coming out today. I know it's not easy to face these guys, so I just have a question, and I think I know the answer, but I just want to make sure. You know, these specific lethal drugs that we're talking about make their way to our streets through a long supply chain. Is there anybody in that supply chain for whom you think it would be appropriate to subject them to the criminal justice system for if what they bring into our streets results in a death?
I would like to make one point first, which is people have been talking about a lethal dose of drugs. That lethal dose varies based on the person, right? So it varies based on their tolerance. It varies based on if they are consuming other drugs at the same time, if they're mixing different drugs. It varies based on the person's health condition. So I just want to be clear that there's no one lethal drug for any person.
I hear you. Maybe
Yeah.
I can make my question more
Yeah,
clear.
I get what you're saying.
I get what you're talking about, the 2 or 3 people who are engaged in drug use and somebody shares a needle, and I understand those factual scenarios. But up the chain, people who run the labs, people who fly the airplanes that bring the substances into the country, people who are engaged in the bulk distribution of fentanyl, for the record, do you think those people should be subject to the criminal justice system?
I think that we have laws on the books that already address those issues.
Okay, thank you.
Any further questions? Vice Chairwoman Agello.
Thank you for your testimony and providing a little bit different perspective. I'm curious, can you estimate how many in Rhode Island, Shawn and Alyssa's, there are? How many people battling addiction to heroin and fentanyl?
I don't have that exact number. We do know that last year in 2017, 319 people died. We know that many, many, many people, most overdoses are not fatal, and many more people overdose. I don't have that exact number of the number of people who are battling addiction, and it's a hard thing to estimate. But we know it's many people, and I can imagine that many people in this room personally know someone 1 or 2 degrees removed.
Do we have a number of total overdoses in the state that were treated by first responders or at a hospital?
I don't have that number personally, but if you go to Prevent Overdose RI, they do track the number of people who come into the emergency room in the event of an overdose. Yeah.
Thank you.